Hey guys, how's it going? I want to quickly discuss about blood pressure values in the elderly. I'll give you an example. You had a 90-year-old grandpa who has never gone to a doctor, and now suddenly goes to the doctor because his family starts compelling him. And then he goes to the doctor, and then they check the blood pressure and it's 160. So what are you going to do about it? Maybe it is, of course, hypertension, and you can attempt to bring it down. But the other possibility is that maybe you shouldn't really bring it down and leave him alone, because if you bring it down, they may start having symptoms of low blood pressure, and they may start having blacking out spells, start fainting. Okay, so it could be a wrong thing to do. Okay, so you have to play it by the ear and approach each of these case by case. See, the vital signs that we have in our body, your pulse and your blood pressure and all that, it keeps changing over a period of time, as we grow up. Like, for example, when you're a 1 or 2-year-old child and your heart rate might be 100 or 110, but when an adult starts having heart rate like 110, 120, then they may start having palpitation. So that's abnormal for them. But for a child to have a high heart rate is okay. So similarly, with regards to the blood pressure, an adult should have a blood pressure less than 120/80. And when it is between 120 to 129, the top number, that's elevated blood pressure, but it's still not called as hypertension yet. But when the blood pressure goes into 130s, 130 to 139, then that's stage 1 hypertension. And when it's about 140, then that's stage 2 hypertension. And so once you got the hypertension stigmata stuck on your chart, medical chart, then most of the time you quickly need to do some lifestyle changes, cut your salt intake, decrease your weight, control your smoking and alcohol and all that. And you have to do everything. Just Google it. You'll know what to do. And then if that doesn't bring the blood pressure down to less than 120/80, then you may need a pill. But with regards to the older patients, like a 85-year-old with a top number 160, see, what happens is the blood vessels, they get hardened a little bit, and they are not as elastic as a young person. So when you check the blood pressure with a cuff, the cuff first has to overcome the resistance of the hardened blood vessel. So that adds maybe 10 or 20 or 30 points to the actual blood pressure value. So the actual blood pressure on the inside of the artery might be just 120/80, but because of the arteriosclerosis, that's the name for it, because of the hardened blood vessel wall, it may appear like 160 or 150, but you shouldn't treat it, because if you did, then they may start having fainting episodes. Okay, so you have to play by the ear and treat each patient differently based on the symptoms and what they come to the office with. Hopefully this helps. Okay, I'll talk to you later in my next post. Goodbye.